Hello, everybody. This is Dr. Galia Anderson, founder of Dental Business Experts. I'm here today with Timothy Brown, CEO of ROI Corporation. Timothy is an authority in the dental space, and we would like to dive in right into the questions. There was a publication in Oral Health magazine that sparked quite a bit of controversy, and I received a lot of emails from dentists asking some valid and tough questions. So I would like to read these questions to Timothy and find out his perspective on what's going on. Are you ready?
I'm ready.
Question number one. Did that private equity save dentistry, or did we hand them the scalpel? Can private equity groups double the profitability in the practices they buy? If they do, does that mean that they're the villains? And they're just doing what private dentists should be doing all along?
Okay. No, I don't think private equity saves any industry. I think they do carry a scalpel because their mandate is to carve out profit that is presently being enjoyed by the independent practice owners in any profession, dentistry, veterinary, optometry. These accumulators exist in many other industries outside dentistry. So no, they have a scalpel, Galia. They do not have this great helping hand, because that's their job. And they're trying to carve out 10, 15, 20% of the profits that are existing in dental practice and keep it for themselves. That's what they do. Private equity is an investment business. It's not a helping hand business. Just repeat the second part of the question for me.
Yes. If PE groups can double profitability in practices they buy, does that mean they're villains, or they're just going to do what dentists should be doing all along? Can the dentist have the capacity of doing that? Or if there is that idea in a profession on a myth that dentists only should be doing drill them, fill them, bill them, and hand everything else to somebody else to handle. What is your perspective on that?
Well, first of all, I don't think private equity does double profitability in dental practice. There's only so much room for profit enhancement in any business. I think we all, for the independent dentists that are watching this, stop being so hard on yourself. You're probably doing the best you can do as a business owner at the present moment. You're doing your best with human resource management. You're doing your best to negotiate supply costs. You negotiate rental rates with landlords. You negotiate with your laboratory bills on occasion. So I think that most dentists are doing the best they can do. And I don't know how private equity can come in and double the profits. There's only a few ways that you could possibly achieve that. And one is to substantially lower the cost of dental supplies in dental business. And I don't think that private equity can do substantially better than the individual. They do better. They have volume. Economies of scale can help. But if dental practices average, say, 8% in Canadian dental practice, how much lower can they go? 7%, 6%? It stops very quickly. So a 1 to 2% change in supply cost may increase profits, but it's not going to double them. Nowhere near doubling. Let's go to the number one expense in all dental practice right now. Can private equity get the cost of wages down in independent dental practice or in accumulated dental practices? Absolutely not. They have to pay fair market rent and fair market wages in the marketplace, just like everybody else. Would a hygienist or assistant want to go work for corporate equity for less money than independent practice? Absolutely not. In fact, the informal surveys we're performing show that staff prefer the independent dental model because they're working for an owner. They're working in the leader is on site. The leader's not in some ivory tower. So I think it's a myth that corporate dentistry or the accumulators can substantially increase profits. So far, they've appeared to be impotent in raising revenues, other than a very recent effort by one of the big ones to come out to the public and finally say, this is who we are. We're a dental organization. They're advertising direct to Canadian consumers for the first time in Canadian history. So maybe by increasing patient flow, new patient acquisition, which is taking patients away from every independent, that's their goal. There's only so many new Canadians being born. So I don't think they're going to double revenue, and I doubt that they have any history of doubling profits. Maybe a 5 to 10% improvement in profitability, but they take 10, 15 to 20% off the top. So what's left at the end of the day? Thanks for asking. That was a loaded question.
That's so true. Thank you, Timothy.
Thank you, Galia.